Good morning to all of you. My name is Ana Zão. I'm a musician, researcher, and medical doctor specialized in performing arts medicine and physical and rehabilitation medicine. At the European String Teachers Association Conference 2020, I will present you a lecture titled String Musicians' Health Problems, Bridges Between Clinical Research, Teaching, and Instrumental Practice. Firstly, I would like to thank the Scientific Committee for the opportunity to participate in this scientific high-level conference. I also would like to congratulate the organizing committee for all the efforts done on the organization of this conference and the effort to keep it up in the best possible way regarding the current pandemic situation. At the end, I would like to praise musicians in general and music teachers in particular who have been able to reinvent themselves in this pandemic phase, keeping teaching strategies, innovating and taking music to the students and to the general public so that culture continues to be sown in our society. It will be a pleasure for me to share with you some of my experience and knowledge, giving some advices regarding musicians' health problems, particularly in string musicians. And so, in this lecture, we'll talk not only about musicians' health problems, but also how to promote health among string musicians and how to create bridges and synergies between clinical research, teaching, and instrumental practice. Who already had or know someone, student or colleague, who had pain or some health problem related or aggravated by playing the instrument? Do you think it is a prevalent condition? Yes. Musicians may experience a range of health problems including neurological, musculoskeletal, auditory, respiratory, dermatological, and psychological conditions, which may be the result of or impair musical activity. Pain and other musculoskeletal symptoms are the most common health complaints experienced by musicians. The 12-month prevalence is around 86 to 89%, and in some studies it can go up to 97%. Literature specifically regarding string musicians corroborates this high prevalence of playing-related pain and functional disability, and some studies comparing by musicians group even show that string musicians appear to have the highest prevalence of pain. Therefore, this represents a huge problem not only because of its high prevalence, but because it has a significant negative impact on musicians' performance and quality of life, sometimes leading to the end of a musician's career. And what are the main health problems in string musicians? Musculoskeletal and neurological disorders are the most common, as we talked before. Some examples are epicondylitis and other tendinopathies, myofascial pain syndrome and muscle contractures, nerve compression syndromes, musicians' focal dystonia, among others. However, the specific health condition and the etiology and location of the pain vary by instrument. We will discuss these too. And when do pain or disorders happen? They may appear from the first week you play your instrument or at any time in your career, perhaps even more during more stressful or more demanding phases, or it will simply never happen at all. Although, as we already talked about, only a small portion of musicians will never get to develop pain or any kind of injury. And why do they happen? Several factors have been associated to the development of musicians' health problems, although literature is still scarce. Few studies showed an association between playing-related pain and instrument weight, average number of hours playing per week, previous musculoskeletal injury, music performance anxiety, high levels of stress, being a female playing string instrument, and several biomechanical and perceived physical environment risk factors. However, until now, no causality relationship is determined since most studies have a cross-sectional design. In this lecture, we will also talk about how to prevent and treat musicians' health problems. How can preventive measures improve the musician's performance? How can musicians help themselves and their students? Do teachers have a role in the prevention of pain and disorders in their students? Of course. And what about when pain and injuries occur? What to do? And why do musicians need a specialized clinical approach? What are the barriers to improve musicians' health? And how can we optimize string musicians' practice and teaching? Finally, how to build bridges between researchers, clinicians, music teachers, and musicians. These are some of the questions I propose to answer and discuss in this lecture. I hope to find you soon at the conference, hopefully in a live mode. Until there, I will continue the battle at the hospital, and if you can, please stay at home and protect yourself and your loved ones. See you soon.